to a special runners presentation. It's Wednesday, October 25th, 2023. Today, we're going to show you guys how anyone can take $1 and turn it into $3 when it comes to your medical and health expenses. Everyone needs a health matching account. As always, I have my good brother here, Ricardo Hamilton. My man, I'm excited about this, and I think everyone's going to find a lot of value in it.
Yeah, I mean, we always find, next level innovative platforms and systems that people can use. And I say this all the time, but people don't know what they don't know. So I get excited when we can bring information like this to them, because I believe that this is something that everybody's, literally needs, which is healthcare. And if you're not familiar with HMAs, okay, you're going to love this information and you're going to love to take advantage of it.
So if you have insurance, you'll want this. If you don't have insurance, you'll want this. If you have Medicare or Medicaid, you'll still want this. All right. So let's get into exactly how this works. And just so you guys know, this company has been around for over 8 years. They have proprietary and patented this HMA, so you cannot get it anywhere else but this company. And especially if you have an HSA, this blows an HSA out of the water. So what
that's
is
huge.
a
I just
health?
want to reiterate that, Mike, that we're literally sharing with something to you that's exclusive. This is you probably only heard about this from the runners, and you will only be able to get this through the runners unless you know somebody else who is offering the HMA. But we're offering something that's very exclusive. Okay, so get excited about that as well.
So what is a health matching account? The HMA pays not only for the medical services that you need, but also for any elective procedures that you want. The HMA is the ultimate medical savings product available that will bring you life-changing health and financial benefits. The HMA will allow you to not only be able to save money on your out-of-pocket medical expenses that your health insurance and Medicare does not cover, but through these medical benefits you are receiving each and every month over time, you can also secure the ability to save money on your health insurance or Medicare plan. Now, how is that possible? The HMA secures you up to $2 in medical benefits or more. It actually goes up to $3, sometimes even $5 for every dollar above and beyond what you contribute into your plan on a monthly basis as the program progresses. These kind of medical benefits may allow you over time to raise your health insurance deductibles to higher levels and thereby significantly reducing what you pay for your monthly health insurance premiums. So a lot of times when people go to pick their health insurance, if they go with a higher deductible, they have a lower monthly premium. But then they have to find a way to cover that higher deductible, whether it's $5,000 or $10,000. Now with an HMA, you're able to raise your deductible, thus lowering your health insurance monthly premiums. So not only is the HMA taking $1, turning it into $2 or $3, you're able to lower your deductible and save even more money from your health insurance provider. Because to be clear, HMA is not health insurance. It's a health matching account. Yeah. Your HMA medical benefit plan can be used at most any of your medical providers to pay for your out-of-pocket medical services. This includes copays, coinsurance, deductibles up to the amount of your available HMA medical benefits that you have in your plan at the time of the claim. You can access it easily with a card. Now, they used to have a Visa card, but they were running into issues with the providers using the wrong codes and such. So now it works just like an insurance card would. You show it wherever you're being billed. They call in and everything is taken care for you. Super simple, super straightforward. Ricardo, anything else that you want to add about how life-changing this is going to be for so many people?
Yeah, I mean, this is huge. The simplicity of the process, they've enhanced it, and just to be able to cover, these medical expenses that come up, and I get excited because it literally covers everything, essentially, almost. I mean, a lot of things that people probably don't think it covers, and we're going to get into that in more detail. But this is something that when people really realize the value that's here, it's a no-brainer, and they realize they need it. Yeah.
100%. So here's 10 reasons everybody needs an HMA. If you want superior monthly medical benefit matching and healthcare savings, you want flexible monthly payment plans, enjoy your paid up medical benefits and potentially reduce your health insurance premiums, guaranteed growth of your medical benefits, guaranteed issue, no concern over pre-existing conditions. You don't have to wait for an open enrollment. It doesn't matter if you already have health issues, no one's denied. Super easy to use. Track your medical benefits in real time. HMA benefits roll over year to year, so it's not one of those spend it or lose it. And it can go to your beneficiaries. And now you can even afford elective procedures that would not normally be covered by an insurance plan. Ricardo, which one gets you the most excited?
Well, I think that everybody can get this regardless of pre-existing conditions. That really, because a lot of people, they say, I have this, or I've been to the doctor for that, and they, am I going to be covered? And everybody can take advantage of this, pre-existing conditions or not. I love that, obviously, the growth, guaranteed growth in your medical benefits. So you essentially are going to get more than what you put out, right? And then, of course, now I know you talk about elective procedures, but once again, it just covers things that people didn't even realize that they can get covered with this HMA. And so it's huge. The benefits of this, when you really compare it to other, health insurances and other things that you have, this is a great benefit too, in addition to that, even though it's not health insurance.
And the key here, guys, is of course, is inflation is here. It's real. People are struggling in this economy. So this is just allowing you to stretch $1 into $2 or $3 when you need it the most. So let's look at a specific example of how this works. So the example is using Woody. So Woody starts at the bottom of the ladder. In month 1, he gets a HMA plan that is $140 a month. Now that first month, there's some maintenance fees and, there's some clerical stuff that is not going to give him dollar for dollar yet. Okay. So he puts in 140 and he's able to spend 110. Now we go to month 8. Woody has put in $1,120. He has $1,160 available to him. So once you get to month 8, you've kind of paid the upfront fees and costs, and now you have more available than what you have put in. Then we get to 1 year. Woody's put in $1,680. He has $1,980 available to spend. We go 1 year to month 24. Woody's put in $3,360, but he has $5,400 available to spend. And when you get to month 35, you have your total contribution paid into his HMA plan of $4,900, but he has a medical benefit available of $10,000, meaning he's only put in, for every dollar he has put in, he can now have over $2 to spend on any medical procedure he wants. So what would that look like? Woody gets a broken leg. It's a $4,600 expense. That would bring his available medical benefit down to $5,400. Essentially, that medical bill was free, right? He used the money that they matched in his account. He still has $5,400 left. Now, here's the most amazing part, Ricardo. Woody continues to make his monthly payment of $140, and he pays back that $1,540, or in as little as $1,540, to earn back the $4,600 cost of his broken leg. Paying only $1,540 gets Woody back to his $10,000 target medical benefit cap. I mean, that's unbelievable that essentially that broken leg, that $5,400 was free, and then all he had to do was put in another $1,540 with his $140 monthly payment, and he gets back to that $10,000 cap.
Yeah. That matching bonus is huge. That extra money, we talk about that dollar turning into $3, and that's where it kind of has that benefit when you're in that month, in those greater months where, I'm saying you're putting in, $1 and you're getting, way more back in return. So yeah, 1540, and now he's back at the 10,000. That's huge. That's huge.
And just so you guys know, this covers entire families. Your spouse or the first person you add in your household is $5. The second person would make a total of 15. And then after that, everyone's covered. So if you have 3, 4, 5, 6 kids, $15 extra a month, that's it. Covers the whole family.
Yeah.
All right, so let's look at what is specifically covered. Elective procedures, LASIK, plastic surgery, as long as a doctor's doing it. Okay, liposuction, BBLs, whatever you want done, as long as a doctor's doing it, it's covered. So this allows you to plan for those expenses and save 50%, up to even more than that. Ambulance services, podiatrist, chiropractors, 2 routine adjustments per month. Counseling services, as long as it's done by a psychology doctor or a PhD. Dentist, orthodontist, drugstores, pharmacies. No over-the-counter medicine, but if it's a prescription, it's covered. Hearing aids, hospitals, hospital equipment, laboratory, medical and dental laboratories, opticians, optical goods, eyeglasses. I would assume contacts with that. Optometrists, prosthetic devices, and osteopathic physicians. Ricardo, that's like 99% of anything someone's going to spend money on when it comes to medical stuff.
Yeah, no, this is why this is huge, because that's all covered, folks. I mean, that's all covered in this plan. And I think, everybody is going to be using these services at some point. But even if they didn't, like you said, Mike, this is your family can benefit from it. And then even if you didn't benefit from it, you can pass this down to beneficiaries. No, it's a no-brainer. Everybody should have an HMA.
Yeah, there's just no way you can lose. Now, what is not covered, again, the HMA covers most 213D medical expenses. That includes pharmacy and drugstore purchases, doctors, hospital visits, dental, vision, chiropractor, like we said. But here's what is not covered: drugs, alcohol, or any rehabilitation facilities, over-the-counter medicine, including non-prescription purchases at pharmacies, payments to medical collection agencies. So if you already have medical debt, you cannot use this to pay it off. Healthcare financial consultants, massage therapy, acupuncture, naturopathic medicine, supplements, elective procedures not performed by an MD, a doctor, annual memberships for dental expenses, annual, semi-annual, or quarterly membership fee payments for direct primary care or concierge medical services. You can do monthly of those, though. Cosmetic or other elective procedures not performed by a medical doctor. The HMA will not cover and reimburse any payment plan set up for an outstanding past, present, or future dental bills. So these are the only things that are not covered. It's a very small list, Ricardo, that most people will probably never use.
Yeah, no, I agree. Yeah, it's a very small list. And so for people to have that benefit with the HMA to get all those things that they will use at some point, or their loved ones will use, their relatives at some point, is huge.
All right. Now, there's a couple selections of which plans you can do. And we did an interview. We'll bring it up here in a little bit with one of the clients, one of the people from their own office. And one of the things you want to do is double your deductible. So if your deductible is $5,000 with your health insurance, then they would recommend the HMA 10,000, because you want to go above and beyond that deductible to make it easier to cover the expenses. So basically, you're going to have that purchasing power of $10,000 when you're only putting in $5,000. This is exactly the plan that Woody had in our scenario. Now, it starts out for as little as $40. So in that 35 months, you're going to put in 1,400. You'll have a medical benefit of 1,100, and your cap's 2,500. So you're not quite getting dollar for dollar at those lower levels. Once you get to HMA, the HMA 10,000, that's where you're putting in $1 and you're able to get the purchasing power of $2. And it can go all the way up to HMA 6,000, where your cap is $6,000. Okay. Now, you can always move up, or I'm sorry, move down or get a bigger package if you want at any time. So let's say you come in at the HMA 5,000 and you're like, this is awesome. You know, I'm using this, I'm saving money. You're like, I want to contribute more into this. You can move up to the 7,500 or the 10,000 whenever you want. If you want to come down or pay less with your monthly contribution, you have to be in for 2 years. So it's okay to start low just to see how everything works, because you can always go up, but you have to be in 2 years to come down. M.I.M.S, anything you want to clarify with, you know, the monthly payments and whatnot, and maybe talk about how, don't think of this as, you know, a payment or a bill, because you still have access to this money for your health care.
Yeah, it's not, you still have access to the money, folks. So this is the thing about it, which is so huge. It's not like I'm paying, you know, a bill. It's almost like you're saving up money for future use. And because you're using this HSA service, they're going to give you more money for saving with them. So you could have saved, so even with the HMA 10,000, you could have saved $4,900 cash yourself, right? And then that's all you have is the $4,900 cash. But if you had saved the $4,900 cash on a monthly contribution of 140, you're getting an extra $5,100. You know what I'm saying? They're giving you $5,100, which really now you have $10,000 after 35 months of money that's available for you for those medical expenses. And you saw the list that it covered, even elective services. You know what I mean? So that's huge, and everybody benefits for this. So the thing is you're going to have, most people have a deductible, and most people, you know, like Mike talked about, you know, if your deductible is higher, then your premium is higher. Well, now with this, you can have a higher deductible, okay, which will lower your insurance premium, but you know that your HSA will cover your deductible, or can cover, you can use that to cover your deductible. And let's like, once again, if you got an HSA, if you got your
HMA,
deductible, HMA, sorry. If you got your HMA, at 10,000 and your deductible is 5,000, that's the ideal situation you want to be in, right? Because of that benefit that comes with this HMA account, where they're giving you more than what you've paid into the account, right? So that's huge. Is people really need to understand that this money is here for you for you to use, for your loved ones to use, and if you don't use it, you pass it on. You can pass it on. So I mean, $4,900 I've saved up, but yet I'm getting an extra $5,100, which means I got $10,000 that I can use to cover medical expenses.
It's game changing, man. There's just no way to lose with this. And if you have an HSA right now, a health savings account, all you're doing is getting pre-tax dollars, which is probably for most people 10 to 20%. So you're saving 10 to 20%. I guess you can factor in Social Security, Medicare, you know, 25% maybe. This is giving you 50% and above of more purchasing power and savings. So yes, guys, it is this good. Like I said, this company's been around for 8 years. You do not have to be a part of Smart Finance to do this. There's no thing to join. Okay. It's literally, you go to the link down below and it takes you about 5 minutes. You can't be denied. It's just basic information. Your employer doesn't have to approve this. This is you only. If you have your HSA plan, you can get rid of it if you want. You can join this. You don't need to wait for your employer. You don't need to wait for an open enrollment. It's open all the time. If you want more information, the website is healthmatchingaccounts.com. They have some videos on there that explain it as well. That's on the website. I'll bring it up here in a minute. My link to join is there. Ricardo will add his after the fact. And it gets better, guys. Okay. Now, this is a separate entity, but it's essentially kind of done by the same people. All right. Cover all of your domesticated pets under one pet health matching account. So this works very similar to the HMA for people. And to be clear, guys, you only need one of these to cover all of your pets. You got 2 dogs and 2 cats, one plan can pay for anything that they need. And we'll get into that. So it works the same way here. If Rosie and Olive get the 150 plan, 110 is available to spend on the first month. Once we get to month 9, it's dollar for dollar. She has put in $13.50. She has $13.50 to spend on all of her pets. Once she gets to month 35, she's put in $52.50, and she has $10,000 available to spend for her pets. And even if, God forbid, your pet passes away and you get a new pet, that money carries over. So if you're a person who loves pets, you're going to be having them for a while, this is the best way to save money on, veterinarian, any prescription medicine that they need. It's absolutely phenomenal for people who have pets. So here are the options or monthly plans for pets. They start with as little as $40. So that 35-month contribution, you'll put in $1,400. You'll have the spending power of $2,500, so $1,100 for free. The break even is at the 208 is where you will put in more. So it's a little bit lower. You're not getting quite as great of a deal with the human one. But again, you're getting massive savings there. Putting in $2,940, you're getting $2,060 in added benefits up to $5,000 with that monthly contribution of $84. Their main website is pethealthmatchingaccounts.com, and they also have a video there. And M.I.M.S, I'm going to go ahead and pull up their
just so
website.
people know.
You kind of want to close us out.
Yeah, and just so people know, anybody who has any questions or definitely want more information, just reach out to either myself or Mike. And we'll also be putting this inside the Runners app, okay? So there's videos and other videos that we have for the HMA, videos that we've done with one of the owners as well. Is inside the Runners app with the links under the video. So definitely get your questions answered. Like, we don't just bring anything to the community, okay? And so when we're sharing something, I want to make sure that you understand the value it is that we're sharing, so you can determine if this is something that you want to take advantage of or not. But don't just assume. Don't make assumptions. Make sure you know the value that's being offered with this HSA to figure out if it's a fit for you and your family and your loved ones.
So this is the website. If you guys want to go here for more information, as you can see, it's been featured in Forbes. Patented approved health matching accounts. Save money on your medical spending than ever before. And the videos, you can come here to get any more information that you want. The videos are right here, the HMA explanation videos. They have a 2-minute trailer, an introduction video, 3 reasons why you need the account, and sign up for the HMA today. And let me show you guys actually where it is in the Runners app. And I'll add this in after. So you're going to come to Smart Finance and come down here, health matching accounts. So Elliot from the HMA came to join us, and we get into more detail. And if you want to hear it from somebody from their actual business, make sure you go in and watch that video. And we go out for about 40 minutes, and he gives a lot of really good testimonials of how many people this has helped, get access to medical care that they needed for a lot less. Yeah, I think that's it, guys. Like Ricardo said, reach out to us if you have more questions, but I've racked my brain to think of any reason why somebody would not do this, and I can't come up with one.
Yep. So, I mean, folks, this is phenomenal value. Once again, we're trying to provide some real solutions, some real value to the community. HMA accounts, everybody's take advantage of it. This is Wealth Wednesdays. Obviously, we're on a 90-day run with Smart Finance. Just one of the benefits that we're bringing to the community, especially in these times. People need options. People need solutions. People need resources, okay? And we want to make sure that we bring something of real value that's proprietary, exclusive. I mean, that's huge, folks. So there's really something here that you really need to understand what's being presented to you with this HMA. So definitely get inside the Runners app. And if you got any questions, let us know.
All right, perfect. We love you guys. We'll see you tomorrow, 12 noon Eastern Standard on Zoom for Trading and Training Thursdays. All right, you guys have a wonderful day. Lace up.
Right.
Let's get wealthy. Peace.
Peace.